I do other topics. And so I want to welcome you to talking about Medicare versus Medicaid. I'm Juanita Bowen. I'm with ProCare Health and Financial Services here in Houston, Texas, the great state of Texas, but I'm licensed in many other states and able to answer any questions or concerns you might have. How do I come by this knowledge? 10 plus years in this business and working directly with Medicare recipients and Medicaid recipients for most of those 10 years. And so I get so many questions daily about how does it work in many different scenarios. And so one of the things that most people don't realize is that Medicare and Medicaid are a set of laws that govern how they are used. Well, the biggest difference between Medicare and Medicaid is Medicare is federal. It's what you've worked for. It consists of 40 quarters or 10 years continuous work. How do they know that? Because it's on your Social Security file. It's where they see your tax returns and your average gross income. So that's how it's determined. Anyone making above $102,000 a year at age 63 is likely to pay more than the standard cost of what Part B premium in Medicare costs. Part A is free. Part B you pay for. Everyone does, unless Medicaid pays for it. So I'm going to give you just a little bit quick tune-up on Medicare and some of the things that we've talked about in the past, because they are worth repeating over and over because they're very, very hard concepts to understand. So when we're talking about Medicare, Medicare is this broad spectrum of what is when it comes to the Medicare world, to when you turn 65, when you retire. But the kicker is not everybody qualifies for Medicare. And it's not really due to if you're a citizen or not. So you have to have worked 40 quarters or 10 years continuous service at any one given time in your career. And that gets you Medicare. Medicare consists of A, which is Part A, which is your hospitalization, hospice care, blood infusions, and that kind of thing. You don't pay anything for Part A, it's earned. Part B is earned as well. So it's not an entitlement, but you do have to pay a cost for it. And so the cost for most people this year in 2024 will be $174.70. That's $100.74. Next year is $185, I believe. At least that's what they're talking about. And so Medicare has gotten so expensive. Just those two items have gotten so expensive for people to manage. So there's other things like supplements that come along. Supplements can be a Medigap plan, like you see the ARP and many others. Any insurance company out there pretty much has their own version of a supplement plan. A supplement plan is not medical insurance. It is insurance, but it's not medical insurance. It only picks up what original Medicare A and B will cover and the remainder of costs that it doesn't. So, for example, if you have a hospital bill that's $100,000, which is not unrealistic, Medicare will pick up 80% of it, and then there's a 20% owed. So either you have, if you're going to stick with original Medicare, you either have a supplement, which is also known as a Medigap plan, or you can have what we call state Medicaid if your indigent circumstances happen. That means if you are poor enough, your income level is not there. In many cases, a lot of cases, people have worked well over 40 quarters, have earned Medicare, but do not have enough income to sustain them, let alone medical costs. And they qualify for state Medicaid. And Medicaid is state, it is not federal. You're not entitled to it. You're only awarded it if you qualify for Medicaid. And Medicaid has a full realm of possibilities, which we will break down next year in January when we quote our OEP happens and when Medicaid really comes into play at that time. And we'll break down how Medicaid works and what it offers and what it can do for you and what it can't do for you. But sticking on this topic, Medicare versus Medicaid. So now A and B is your original Medicare. That's what's on your Medicare card if you have one. You can be disabled and get Medicare. You must be disabled with SSID for more than 24 months to get it. If you are a young person and you were disabled before age 22, you're entitled to Medicare. Yes, you're entitled to Medicare even though you haven't worked 40 quarters. If you have ALS, you're entitled to Medicare. If you're on dialysis and after your fourth dialysis treatment, you are entitled to get Medicare. Those with kidney dialysis, you do have to have worked the 40 quarters. If you don't, then that puts you in indigent circumstances where you possibly will need to have Medicaid. So, and not everyone who has Medicaid will have Medicare. More often than not, we see individuals that have both, but not necessarily both, because there's qualifications for each of them. So Medicare is federal and Medicaid is state aid. Because Medicaid is state aid, it varies from state to state in some little nuances. But at the end of the day, you must qualify financially, not medically, financially for Medicaid. The only way that you can qualify medically for Medicaid and not be in a nursing home with long-term care is to qualify for long-term care at home, meaning that you must not be able to perform 2 out of 6 active daily living activities like transferring, toileting, being able to feed and care for yourself in certain ways. And when that occurs, the state will send out a social worker to verify that claim and deem how many hours of care that you can get that is paid for by that state. So again, most states refer to it as provider care, and that's okay because if you need the help, so you can be somewhat above the Medicaid levels to get Medicaid and still get those circumstances, i.e., I have a client who's both legally blind and an amputee. He can't take care of himself, so he gets Medicaid, but he doesn't get any help on his medical bills, if that makes sense. So this is why those things are very complicated, but Medicaid is only designed to step in and help individuals who otherwise can't help themselves, who are in indigent circumstances that cannot pay. And so sometimes if you don't have any insurance and you're in the hospital, you will get temporary Medicaid to help pay for that hospital bill. Otherwise, the hospital goes broke. I know that's hard to believe, but they happen. So that's just the beginning of what we're talking about when Medicare versus Medicaid. So that gives you some indication. But let's get more into the nuts and bolts of what that looks like, right? So I've got some trusty notes here just to keep myself sane. So Medicare, again, you must have 40 quarters to qualify. Those can be working from age 20 to age 30 or 35. There are small instances when you don't qualify for Medicare that you can take a parent's Medicare, i.e. if your child is disabled before the age of 22. Kidney dialysis is one of them. Having non-cognitive and verbal, i.e. autism, that's the best way to explain it. Certain mental illnesses, like being bipolar and schizophrenic can get you state Medicaid. And you can also be able to use your parents' Medicare. That's the way that some young people who are in their 20s qualify for both Medicare and Medicaid. They are called duals. In every state known to man in the United States, they're called duals. That means they have both Medicare and Medicaid. And so those nifty commercials that you see all the time, that people get all of this, and Humana and United Healthcare and everybody in Aetna saying, oh, we have these fantastic benefits. You must have both Medicare and Medicaid to qualify. And as I've just explained, it's pretty tough to qualify for Medicaid. So in the state of Texas, you have to be somewhere under the 1,200 range, around 1,224 or something like that in order to qualify for Medicaid. And that includes what would be your Part B premium as well, the $174.70. So it cannot be the 1,224 plus the $175. It must be 1,224, and that's inclusive thereof. There are different levels of Medicaid. So in the state of Texas, pretty much somewhat like Tennessee, if you don't qualify for full Medicaid, you could get something that's called partial Medicaid or Slim B, SLMB, as it's better known, Q1, and others that will get you qualifications to get help with your Part B premium. Yes, the state of Texas can pay your Part B premium. So all of you guys out there listening to the tone of my voice, if your income is such that you think you might qualify, you can give the state of Texas a call at 211. Try, after you do that, try option 1, then 2, then 1. Give them a call, get an application going, and get yourself qualified to get that Part B premium paid for you. There are so many different levels of Medicaid. We just talked about long-term care, and that's a very confusing topic, because you can have long-term care and not be Medicaid qualified. You can have long-term care and not be in a nursing home, and that's a different type of Medicaid than being in a nursing home, which means that you need continuous care for the rest of your life. There's usually no upside to that. Your health will only decline. The other type is if you're in the hospital temporarily and you're out and you're doing your thing and you recover, the state will pay your medical bills. And so the hospital social worker will get you qualified for that level of Medicaid. In most instances, social worker will need to qualify you for Medicaid. But if you're someone who is in relatively good health, or not able to be in a nursing home, you're in your own home, and you find yourself struggling on medical costs, i.e. co-pays, because you have maybe a chronic illness and maybe see 2 to 3 specialists, and those specialists are costing you $40 each time. Think about if your combined income of the $174 and what you get every month is lower than $1,242 or $1,224, thereabouts. And that's just for this year of 2024. Those prices on levels do go up because there's a 2.5% raise that Medicare recipients are getting. So if you do qualify for Medicare and you're needing help, just take in consideration that you will get a 2.5% raise, but also the level of qualification goes up as well. So you're not lost on that level of qualification. There's something called the Medicare Savings Program, which is also confusing, which is through the state Medicaid program. It helps to pay that Part B premium. So if you're somewhere under $1,500 or thereabouts, I don't have exact numbers, you can qualify or even fill out an application online at your local state website that deals with Medicare. Now, in every state, it's called something different. If you don't know what it's called in your state, simply go to, say, Illinois.gov or Arizona.gov and look and find out where you can apply for the Medicare Savings Program. That can give you some relief because that gives you $174.70 back into your monthly check. There are some plans that are partial Medicaid. There's not many that will allow you to get certain benefits as though you were full Medicaid. So for that information, you would have to talk to a local representative, such as myself, to find out when and where you can qualify for those local plans. That will give you a certain amount of relief. Now, keep in mind, you might have to give up some doctors and or hospitals in order to get that plan, but is it worth it? Right? So there's always that. There's always a juggling act at this age. And so this is one of the reasons for this show, is because we want to help you finance your future so that there's not much juggling going on. You can enjoy your retirement. You can enjoy those times when you worked so hard all your life and now you get to do some things you want to do. So Medicare Savings Program is paid by your state, not by the federal government. Just a quick note. And it's called MSP, or Medicare Savings Program. So let's go back a little bit to long-term care. That's a tricky one because a social worker does have to verify your ailments to see if you qualify for long-term care. There may be some changes that will be made to your home, especially your bedroom and your bathroom, and maybe even your kitchen to modify. They will see how many hours that you need in order to live comfortably in your home. And you have to take all of that in consideration, because for some people, that's an invasion of privacy. But if you're looking for provider care to stay in your home and get the care, your state will do that by applying at 211 here in the state of Texas. And please go to if you're not in the state of Texas, go to whatever state you're in.gov and find out where you can apply for help in your home. So Medicare itself now is a little bit different animal. Again, it's something that you've worked for. And there's no pity on you if you did not get 40 quarters and you don't qualify for Medicare. It's either you have Medicare or you don't. And you can't get the dual benefits above Medicare and Medicaid unless you have Medicare and Medicaid together. And if you don't have any Medicare and you find yourself with chronic illnesses and things that are very hard for you to deal with, then what's going to happen is that you're going to get some form of Medicaid, maybe, only if you're in the hospital, only if you're on dialysis, when you are very at your last end of the rope. So again, this is something that if you find yourself not filing your taxes or not participating in our great tax system, you may not qualify for Medicare. And qualifying for Medicaid may be very hard as well. Unlike the misconceptions, not everyone qualifies. In fact, in our great city of Houston, Texas here, we have almost 1 million people who don't have health care of any sort or any kind, including Medicaid. And not everyone is I don't know, lucky enough to be in Harris County, with one of the largest counties in America, where you can get some assistance through Harris Health Systems or a local county system that offers, help through LBJ Hospital or Ben Taub. Shout out to those who help people in need. If you happen to be in Galveston County, then you have access to UTMB, which is University of Texas Medical Branch. But if you're in Brazoria County, what do you do? If you're in Matagorda County, what do you do? If you're in Jefferson County, what do you do to get that kind of help? And so there's so many people in these areas that I just named that are very local to Houston who do not have access to proper hospitals and doctors. So yes, there are doctors in that area and there are small hospitals. And I'm not saying they're not worthy. What I'm saying is that it's very hard to qualify for help in those areas. It's just not there. And so we do have some solutions for that to help you with some healthcare costs and to be able to see a doctor. But we don't have right now any way that's cost effective to help you see something in the hospital, to get a tonsillectomy or to get appendix or things like that done, except for qualifying for state Medicaid in an emergency situation. So what that means is that you got to be near death. Hopefully in the future that will change. And if there's anybody out there that's hearing this and you know something different, please DM me at Juanita Bowen on Facebook, or go to ProCare Health and Financial on Facebook and DM me that way. So what else does Medicare have to offer for people in need? Well, there's also extra help with Medicare, and it helps with your prescription cost. So people who have, and then this income is a little bit higher than what you qualify for Medicaid. It gets a little bit higher. Basically, if you're just over $17,000 a year or just over $34,000 a year, you probably will qualify for what we call extra help on your medicines. And they've made it easier over the past few years. So there's not that many different levels or qualifications. If you qualify, you qualify. So I encourage you to go to Medicare.gov or SSA.gov. And you can go through Medicare.gov too, but it's easier to go directly to SSA.gov /extra help and apply. And you would be amazed at the savings you can get on those expensive medications. And this also includes paying for your deductibles. Deductibles on medicines this year is $545. Next year will be $590. Yes, I did say $545. Now, not all healthcare plans and HMOs and PPOs and Medicare Advantage plans will have that higher deductible. But if you have a chronic condition, such as kidney disease, take insulins. Insulin's on Part B, by the way, not on Part D anymore. But those support pens that support insulin, but not an insulin. So those really get you into trouble. Those are very expensive and can lead to crazy amounts of money. Luckily, in 2025, there's no donut hole or catastrophic place for you to be. But you do have to spend out of pocket, you and your insurance company, $2,000. Now, that can be a lot for a senior. And I'm not a senior. I don't want to spend $2,000 on medicine. I just don't. I just do not. If you're spending more than $25 a month on medicine, we have a solution. And I'll give you those solutions at the end of this podcast. But I really, really want to focus on the topic at hand, and that's Medicare and Medicaid right now. So Medicare is a drug program to help you with medicines that cost a lot. And there's some really decent plans out there, even if you take minimal medicine maintenance medications like your atorvastatin, your statins or Lipitor, your high blood pressure medicines. Let's see what else. Some small pain medications, and even some asthma medications that will be in tiers 1 and 2. And I'll get to what those tiers mean in just a moment. But keep in mind, each plan is different and has a different formulary. And then one plan to another may cover the same medicines, but not in the same way, meaning that it may be in a higher cost tier than it was before, or either lower cost tier. So remember this Medicare season. Please have your medicines examined by a reputable agent that can give you great informative information about your plan and plan costs. It's very important. Medicines are one of the most expensive things in Medicare. And so when we're talking about today's topic of Medicare versus Medicaid, we're talking also about how to save costs on these items. You don't need an account, an SSA.gov account to sign up for extra help. You can go in and apply, and it will ask you very specific questions. It's basically a 2-page application, not too invasive. And the second thing you do is you just verify your information, but it's a little tricky. It'll ask you to apply, ask you some questions, and you think you're done and you're not. There is a number that you need to write down. It's a reentry number just in case you close it out accidentally, but proceed on. It's going to ask you, is your income more than like $17,400 or whatever that number is? It's a little over $17,000 a year. If that number, and that includes your Part B premium. People don't know that your Part B premium is taken out of your Social Security check before you see it. So anytime you're giving information to both Medicare and Medicaid, you have to include that premium cost in there. So for example, if your check comes to the bank and it's $1,200, you actually get $1,375 instead of $1,200 each month. So you have to include that amount in there. And the levels that I gave you must include that as well. So just say, for instance, you're applying for Part B premium and to be paid by the state of Texas, you must include all of your income, and that includes what they take out for your Part B premium. Okay, but getting back to SSA.gov, extra help. So if it's husband and wife, it's a little bit more than 34,000 combined. It's just double what it is for one person. Very simple, right? It takes Medicare or Social Security, that is, about 2 weeks to process an application, up to 60 days. This year, they're a little busy. A lot of people got sent out applications this year to return them back. More and more, they're pushing those applications out. But if you haven't gotten one, it doesn't mean that you cannot apply. Again, simply go to ssa.gov, extra help, or low income subsidy. Answer the following questions. Calculate your income based on including your Part B premium of $174.70. If it's more than that, you don't qualify. But if it's that or less, then you qualify, and or probably qualify. But if it's more, if it's the 206 or whatever, you're already out of the income range. You won't qualify because you only pay that extra when you make way more money than everybody else. So go to ssa.gov/extra help, apply, simple application. It takes about 2 weeks to 60 days for it to be processed and returned to you. Please give them time to process it. You can go back and check on it with your reentry number and check on the progress of your application. This is very simple to do, and it takes only just a few moments to do it. If you can't do it, get someone who is a little computer savvy to do it. The best way to apply for these programs is online. Once you have applied, keep all reentry numbers and a copy of the application on hand. Just simply save it to a desktop and or take pictures of it or whatever you got to do, or send it to someone else's email, but keep a copy of that application so that you can go back and see what the progress is. Once that has been processed, they will send you, and I love this, these really decorative, different color pieces of paper. They'll be yellow one time or purple or green, and they'll let you know that you've been accepted or denied. If you are accepted and you do not have a prescription drug plan, they will provide one for you. Typically, if there's any late enrollment fees with your prescription drug plan, it usually can be accessed and usually can be absorbed in that cost. I'm not sure if they still do that. It's up to the federal government if they do it, but it's a great way. If you're taking a lot of prescriptions, you can't get any help, this is a great way. But for those people out there who don't qualify for low-income subsidy or extra help for your medications, I have a solution for you as well. Believe it or not, more and more people have heard the cry, and they're getting more and more help and more solutions to high cost of prescription drug plans and prescriptions. I know the pharmaceutical company doesn't want to hear this, and I'm sorry, but people need help with medicine. The only thing that's better than getting help with medicine is not taking any medicine. And if that's not an option for you, then please seek help. We have ways to help you in almost every instance. So that is one way to help on medications. Medical costs are really absorbed into Medicare. And if you can't get them absorbed into Medicare, again, there's other solutions to do that. So let's pivot back to Medicare a little bit. So Medicare plans in the prescription drug world are a little crazy right now. And if you have Medicare and extra help, thank God for that, because they are a little out of control. We no longer have the donut hole in Medicare starting in 2025. But what has happened is that what you and your insurance company will pay is a maximum of $2,000, and that may include any deductibles. This is in Advantage Care plans, right? This is not this. We're talking solely about Part C plans right now that are governed by private insurance companies such as a United Healthcare, Humana, Blue Cross Blue Shield, and et cetera. So in Advantage plans, your plan, your prescription drug plan is kind of offset by itself. It's not included in your maximum out of pocket that like your Part A and B are. It's actually a separate entity because it was added to Medicare years later. And if you notice, there is no Part D on your original Medicare card. However, there are penalties for not taking a prescription drug plan. So if you're one of the lucky ones out there and you take no medication, you still need to have a prescription drug plan. And in many cases with an Advantage plan, the premium cost is zero because you're already paying $174 more. So the premium cost is zero, and that includes your prescription drug plan. So you get off really at a great rate if you're not taking any medicines. But if you are taking medicines, please have your representative this year, your broker, your agent, explain to you your prescription drug portion of Medicare. It is different on every plan. What's the same is the true out-of-pocket, which is the $2,000. So what happens when you get to $2,000 out of pocket? Well, things go to zero. But how do you get to $2,000? So if you're one of those people that's on the line and you just don't qualify by like $100 a year for extra help on your medicines, but you're taking something like an Eliquis, a Farxiga, a Xarelto, and Trilogy and Trulicity and all of those really expensive medications, pens, COPD medication, kidney failure. Like the gamut is real out there. When you're taking those kind of medications and you don't quite qualify, there are some resources out there. I want to introduce you to myprimarycare.com /hashtag/3129. And there you can look and see that your medications are either highly discounted or zero cost. Or there are free prescription cards out here that can help you. The card is free and can take up to $80 off a prescription. As long as you have a required Medicare plan, you can opt to pay cash for your medicines. I don't think that has changed this year. There's a lot of changes. And you can kind of take that burden off yourself, because if you're paying more than $25 a month for your medications, it can hurt. So while you're qualifying to get to that $2,000 level, there's two things that's happening. One scenario is that you have a slightly lower Medicare prescription drug deductible. It may not be the $590 next year, but it may be $100 or $300 or $255 or another number. It still may be out of your reach, right? And if I have a medicine that costs $20, I still got to pay a deductible, which is something that you must pay in order to use the plan and get what you need. You can't get what you need and you can't get the service that's required or the product unless you pay that, right? So if you have a deductible and you don't have extra help, and that medicine is still $25 to $50 or more, consider looking at myprimarycare.com. It can help you save some money. If you need help with that, you just simply email me at juanitarylander@gmail.com. Text me at 832-584-7750, and I'll be happy to introduce you to a way that you can save some money on those prescriptions. Or, ergo, a prescription drug card that can give you some relief. These are real. These are very real. And so there are so many people out here that pay extra amounts for medicine just to stay alive. It's almost really crazy that you have to do that, but this is where we're at. So we won't debate how we got here. I just can have a solution for you if you need it. So the second way in your great Advantage plan that you may have, and they're really great plans, and I'm not being cynical or sarcastic, is that one of the ways that you can reach that $2,000, or may have to, if you have a really good plan, say you love your doctors and they're on that plan, you love your hospital, it's on that plan, you love the benefits you get, i.e. you may get groceries or you may get or utilities, you get great amount of over-the-counter products, you get great dental. It's a great plan, right? And why should you have to leave that plan in order to get cheaper medicine? Well, that plan may require you to pay 25% of the cost of that medicine. So if you are paying 25% of a medicine that costs $2,000, that's $500 every month. That's a lot of money. A lot of money for a 30-day prescription for something that keeps you alive. That's almost insane to a lot of other people. consider other choices for your drug plan. So, ergo, you have a great plan that's zero cost per month, gives you great benefits that you can take and you can use it monthly. Um, Great opportunity for rides, dental, transportation, groceries, etc. But the only thing that's stopping you is the medicine is extremely high. Yeah, there's always a catch, and that's okay. We have solutions. So that's the second way that Medicare recipients are reaching that $2,000 level. They're paying 25% of those expensive medicines, in which, I mentioned some of those. My hot topics on there, those are the ones that my customers use the most, are Farxiga, Xarelto, Eliquis, Tresiba, and Trulicity. Those are the main ones that I work with and I see here with my customer base. And so you want to make sure those meds are covered, right? And that you're not having to give up, because just because insulin is now in Part B, which insulin is not counted in your prescription drug portion anymore. So your expensive insulin won't help you out of that $2,000. What it will help on is your maximum out of pocket, which is something different in Medicare, and we'll touch base on that a later time. I don't want to get too far off topic, but for your hospital and doctors, there's a maximum out of pocket. For your prescription drug plan, there's a true out of pocket. It is what it is. So the next thing I want to talk about in Medicare is how you can combine both getting your Part B premium paid by the state of Texas and by getting extra help on your medicines. That's a great combo, because if you qualify for one, you most likely qualify for the other, especially if you qualify for your Medicare savings program. So these are ways that can help. Medicare and Medicaid, they bounce off one another. And I don't know the politics of them. I don't know why and how, what the determining factors are. I know it's legislation, and it's a balancing act, because not all states have a state tax, like Tennessee and Texas. That's why their Medicaid plans are so similar. And it's just balancing acts for that money, because you have to take in consideration the 3 or 4 ways that Medicare will pay out. One is if you're in the hospital with a very acute circumstances, a very emergent situation, and the hospital needs to be paid. So a social worker will try and get you on state Medicaid temporarily for that time being, usually for a time period of like 90 days. Then it goes away. If you're in a facility in a nursing home, now you have to have long-term care with the progression that you will not get better, that you will maintain this health or you will get worse. So that, i.e. long-term care. So that's another way that the state pays long-term care, and Medicaid pays out. Another way is that if you have, you're sick, but you need help, but you're in your own home, you don't need to be in a nursing home. Like, you can get up and you may need some help getting dressed, or you may need some help getting your food, or toileting, or taking a bath. Those are ways that Medicaid can help with a provider on unskilled labor to come in and do dishes, help you get dressed, take a bath, do other things, help you with rides to and from the doctor, those sort of things. That's what long-term care does. And so when you consider, now we look over to Medicare, now they're going to pay our state Part B premium. That's another way that Medicaid works. So Medicaid does work for those in situations. No, it can't work for everybody, but those are the ways that Medicare can help you and make your life a little bit simpler. In the state of Texas, you can call 211 or simply go online to mytexasbenefits.gov .com, and they can help you, or someone can help you apply without opening an account. There's a way to apply for benefits without opening an account and get those benefits taken care of for yourself. Medicare. Medicare is you must have 40 quarters in order to have that type of situation. So not everyone has 40 quarters. Even people who have lived here all their lives, i.e. if you're a housewife and you're a stay-at-home mom and a housewife for the past 30 years or 40 years, you're relying on your husband's income. if you had joint tax returns. Everything goes on your adjusted gross income. And you should open up and should go into your Medicare or SSA.gov account and look at those things and see where you're at. It gives you so much information about where you'll be when you turn 65 and beyond. Medicare provides you with hospitalization, and it provides you with Part B, which is your medical. So Part A, that's your hospital, your hospice care. And by the way, hospice care does not mean end of life. It could be palliative care. And just a side note, if you are chronically ill, like congestive heart failure, COPD, you can have palliative care as well as a caregiver from the state. This is another way you can legally double dip and get the help that you need. Help is out there. You just got to know how and who and what to ask, and you have to have a specific set of circumstances that apply. So Part A does that, as well as blood transfusions. You get units of blood through Part A. You don't pay anything for Part A. It is earned 40 plus quarters continuous service in your job. The next one is Part B. That is all your medical, your labs, your x-rays, MRIs, testing, all of that is Part B. And now insulin is on Part B as well. Those two items get a maximum out of pocket. When you reach that maximum out of pocket, it's very important to ask your representative, agent, or broker about what your maximum out of pocket is, because if you have any one of those chronic illnesses, again, those were COPD, congestive heart failure, enlarged heart, diabetes, kidney failure. Those are your major ones. If you have any one of those things going on, even on a small scale, you want to consult and know what your maximum out of pocket is. The second thing you should already have is what we call an indemnity plan. If you're one of those people, and I say one of those people who do not have the luxury of having Medicaid and getting aid, you can get a hospital indemnity plan for a couple of bucks a day, anywhere from 30 to 60 bucks a month, that it can help you pay and reimburse you for those hospital costs, reimburse you if you have cancer, reimburse you if you have heart attack, stroke, and critical illness in most cases. They can help you with ambulance costs. They can help you with skilled nursing. And skilled nursing is the final one that I am going to tie in here, because skilled nursing is the only one, and I only have about 8 minutes to go, so I'm going to wrap up. You guys know I can talk and go on forever. But an indemnity plan helps you to minimize your out-of-pocket costs. Whenever you have an incident, say, i.e. cancer, it can be a 2 or more year battle, but on average is a 2-year battle. If your out-of-pocket is, say, $4,100, and you have an indemnity plan that will pay you a lump sum of anywhere $10,000 to $20,000 or $30,000 because you have cancer, now you can continue to pay your out-of-pocket expenses for hospitals, for treatments, for travel, for food, someone to clean your home because you're not going to feel like it, someone to be there to care for you and just, sit with you at night. You have the money to do it on a very temporary basis for a couple of years. And you can determine that. If you have a history of cancer, if your mom, your sister has had breast cancer, if colon cancer runs in your family, you need a cancer plan. This is especially if you have not planned prior to having something like an annuity or an IUL that gives you living benefits. These are living benefits you can buy, and they will help you out in the end. Those products can be sold by any Medicare rep, insurance agent, whether they do health or they do life. They're licensed to do both. And they're a great source of protecting your income, your Medicare income, your Social Security income. I've seen people who experience illnesses and then they have to put a roof on the house. How are you going to do that? It's overwhelming. The second thing that you can do with protecting yourself is also including skilled nursing. So skilled nursing is one of those things where if you have long-term care, you're a dual plan, you have long-term care insurance built in because the Medicaid will pay for that. But remember, that's the long-term care in Medicare that only lasts 100 days. Medicare doesn't go beyond 100 days. So if you have to go beyond 100 days, that Medicaid will be converted into a new type of Medicaid. But let's say we're sticking to under 100 days in this situation. You've had a stroke, you have knee replacement, hip replacement, and you need to be in the skilled nursing facility for a number of weeks. Well, the first 20 days are usually free. But I've seen plans this starting in 2025 that will charge you $20 a day. There's a copay for that. When you get to days 21 through 100, generally speaking, that's $203 per day that you spend. They're not giving it to you. You're spending $203 a day. That's a decent hotel bill, and that you're racking up there, right? And if you happen to be in there more than your 100 days and you feel like you still need care, that's about a $5,000 a week bill. You have to prepare for this. And so this is why we talk a lot about the Index Universal Life policies prior to aging. When you can, we talk about how to prepare for that. This is all relevant to your future and financing it. We're not talking about, yacht trips and, vacations to the Maldives. We're talking about saving your bacon. So when we look at those indemnity plans, you can definitely add on skilled nursing. It is very much worth it. If you have a plan, and a lot of people are loyal to one insurance company, and that's okay. They've served you well. Your hospital and doctors love them. But indemnity plans can work for any policy because it doesn't matter. The one thing you want to do is be cognizant of maximum out-of-pockets rates. And I've seen them go up from as low as $3,100 all the way up to $6,000, $10,000 if you like PPO plans. So let's keep in mind and be cognizant of what that looks like when we're talking about Medicare. There's so much to discuss with a Medicare recipient when you sit down in front of them. And I'm talking both to the recipients and to the agents right now. Be cognizant of that you're helping that person and filling in the gaps. It's very important. Not everyone can afford to have a supplement plan or a Medigap plan. They can be expensive, and I can see them anywhere from $150 a month to $400 plus a month. And they're great to have, but it's a luxury item. It really is in Medicare. It's a luxury item because original Medicare doesn't pay for vision, hearing, or dental, podiatry care, or transportation needs. And those are very much needed items with a Medicare recipient, especially if they have a chronic illness. So I hope what I've said today has been very helpful to you. I hope today that you've gotten a lot out of it. If you're seeing this on my YouTube channel, please comment. If you're seeing this on Facebook, please hit me up and DM and ask me questions. I look forward to our next visit, and hopefully we'll have some guests here pretty soon that can talk more about Medicare and what that means in this area here. So don't forget, people out there in Facebook land and social media world, that an agent can be licensed anywhere. If you need my help, and you think you do, please contact me and I'll be more than happy to help you. And so for today's show, Financing Your Future, Medicare versus Medicaid, I hope I've said something that's informative and not too confusing. But if you're in the surrounding areas and you want to meet me, please just send me a text or a call at 832-584-7750. I'm Juanita Bowen at ProCare Health and Financial Services, and this is Financing Your Future, Medicare versus Medicaid. Just remember, calculate your income based on including your Part B premium, which is most likely $174.70. If it's more than that, you don't qualify. If it's more than that, you should be looking at other indemnity plans, living benefits to help you out in the end. Be sure that you plan for long-term care in your future and protect your assets. So signing off today, have a great one and see you next week. This is Juanita Bowen for Financing Your Future. Have a great one.